All right, Mod 3 review. Just going to go over a few things real quick. Make sure you guys are prepped. Hopefully you're studying quite a bit. Like I said before, this is a very situationally based test. So make sure you're comfortable with what to do based on different situations. Try to think about that using your ABCs, airway, breathing, circulation. Remember, we only go to major hemorrhage first, circulation first, when we have major hemorrhage or possible cardiac arrest, right? So, if you have options about what to do first, focus on something that makes the airway better. Airway, then breathing, then circulation, and then everything else. Remember, don't let answers lead you into situations that don't answer the question. Sometimes you have really good answers that don't answer the question or lead you into a new problem. Make sure we focus on that. We kind of talked about a little bit of this before, but make sure you know what the law of inertia is, what Newton's laws are. Make sure you know what to do in a patient with a suspected C-spine injury. Know when it's important to forego a secondary assessment, when you should skip that. Remember, if you're on your ABCs, you got to skip, you got to focus on those. If you're stuck on those, you stay there until you fix them, right? Know what the term alert means and what is alert, what is not alert. Know what that means. Know what OPQRST, all those stand for. How to assess for OPQRST. If a patient stops responding, know that you have to repeat, or if there's any major change in mental status, you should repeat that primary assessment, correct? Make sure you're doing that. Know what the normal response to pupils, to light is. Know how to explain that. Determining transport priorities. What's a high priority patient and what's not? If you're given a situation of which of the following are high priority patients, be able to determine which one meet that criteria. I gave you some terms to look at, so I'm going to kind of breeze over those here. Hopefully you guys are studying those terms. Remember, some questions are sequence-based questions. So if it asks you a question like, somebody has been was laying on their back and has vomited and has shallow, wet respirations, what should you do first? Remember, it's a situational question that you have to follow that priority levels. So should you start bagging them? Well, no. Have you opened an airway? So the first thing you should do is open the patient's airway and then go on to breathing and circulation, okay? Remember, we don't check for actual vitals until our secondary assessment, or in our primary assessment, we're not trying to get numbers, we're just trying to make sure things are present. So if you're assessing airway, breathing, and circulation, you're not looking for number of breaths at that point. You're looking to see if they're breathing and what quality that is, right? You know the difference between systolic and diastolic blood pressures. Let's see here. You need to know velocity from different types of assault. So would a ice pick be low velocity or high velocity? Would a bullet from a handgun be medium or high velocity? Obviously, assault rifle would be high velocity. Those things would be important to know. I think it goes over that pretty clearly in your book at one point. Just memorizing that will be the challenge. Let's see here. Knowing the difference between signs and symptoms. We talked about that a good bit in the email. When you create a list of potential diagnoses, what is that called? It's a differential diagnosis. You need to know what differential diagnosis means. Lots of situations, lots and lots of scenarios in here. Remember, a patient's chief complaint is what they say is wrong, and our primary impression is what we believe are wrong. Know what cyanosis means? Know what paradoxical movement is? We talked about that a little bit. The ribs are moving opposite the rest of the chest wall. Know when you would use an OPA, when you would use an NPA. It's pretty important. Know normal blood glucose levels. Talked about that. A little bit about seeing size up, that would be important to know. If you're not sure about what an electronic blood pressure cuff would do, what should you do next? That would be important. Hopefully you guys all know that. You need to know what your sample means. How often to assess vital signs in different types of patients? Be pretty important. Oh, there isn't all of the above the answer. Most of the time those aren't real in this setting, but there is one. Know who assigns licenses and radio frequencies? It's one of those kind of off-the-wall questions. So know who gives us operating licenses for radio frequencies? Okay, another one of those order questions. Lots of order questions. Remember, when you walk in the door, you're going to form your first impression, or form your general impression. Then that's as you walk up. So as you get closer, you're going to form that general impression, and then you're going to hit the A, B's, and C's. So make sure that if they give you an order question, read all the options, slow down, read all the options, make sure you have the best option, and go from there. All right. There are 100 questions on this. 100 question tests are good for some reasons. You can get more wrong and still get a good grade. But it typically means that there's a lot of stuff there. So make sure you're studying, make sure you're looking these over, and feel free to email me if you have any questions.